Assalamu alaikum. Adolescent gynecology. I'm talking about this very important topic, and especially in the current years. जिसमें teenage girls they are more concerned about their health, about their cycle, about their growth, and no doubt the parents are also more concerned. So that here just we will talk about the few changes in this age group because it is a time period, very important time period जिसमें childhood से adult की तरफ lead कर रहे हैं. तो इस टाइम पीरियड में कुछ चेंजेस आती हैं. देयर आर द फिजिकल चेंजेस, psychological changes, behavioral and social changes, and it's very important to understand all these changes and to manage accordingly. लेकिन जो इसमें एक बहुत important change है, that is the menarche. And menarche means के establishment of menses. और initial days में, because it's very important to have a good counseling, और यंग गर्ल को एक्सप्लेन करना कि शी इज थ्रू अ प्रोसेस ऑफ फ्रॉम चाइल्डहुड टू एडल्ट लाइफ, एंड देयर विल बी द स्टार्ट ऑफ मेंस्ट्रुएशन. लेकिन उस मेंस्ट्रुएशन में साइकिल को एक्सप्लेन करना और उसकी हैंडलिंग इज वेरी मच इम्पॉर्टेंट, बिकॉज इन आवर एक्सपीरियंस स्टूडेंट्स यही इनके कैरियर ईयर्स होते हैं, स्टडी ईयर्स होते हैं, और इफ दे आर सम मिथ्स or otherwise, or if they don't understand their its physiology properly, it can lead to distress. So that it's very important कि जब menarche की age में either the mother can counsel or you can visit to a doctor who can explain all these changes to a girl and she feels pure. But it's equally important कि अगर abnormal uterine bleeding है, irregular cycles हैं, either it's in duration, frequency or amount, उसको देखना बहुत इंपॉर्टेंट है. एंड स्पेशली इफ इट्स ओलिगोमेनोरिया, लेस फ्रिक्वेंट मेंसेस, और इट्स मोर फ्रिक्वेंट मेंसेस के बार बार आ रहे हैं, या हैवी ब्लीडिंग है या फिर कम ब्लीडिंग है, इन तमाम चीज़ों को, इन तमाम कंसर्न्स को एवेल्यूएट करना इज़ वेरी मच इम्पॉर्टेंट. Basically, menarche की counseling में what's important and from evaluation point of view and counseling, that is onset of menstruation, initial cycles, they are anovulatory so that it may be irregular, and basically it affects on the general health, no doubt leading to the certain effects on the family. Diet is very much important in these days, and the environment is very much important, so that psychological support is there. In evaluation, if there is some problem during the teenage or from transition from the child to adult, there should be complete evaluation by the history examination. And what's important in examination, that is the weight, height, or and especially in the girls, if the with the start of menses the menses are heavy, either there is some history of bruises, or it's equally important to evaluate for the thyroid by the thyroid function test. And the investigations can be baseline investigation or specific according to the first history and examination. And the pelvic ultrasound is has very much important role, and especially in the irregular menses. Or in most of the time, the initial evaluation by the history examination and certain tests leads to reassurance, and the counseling is very much important. And बहुत से जो reassurance है वो counseling से हो जाती है, but in certain cases the treatment is required. And it, but no doubt, but the treatment should be based on the proper diagnosis, because assumption can lead to severity of the disease, and it's very important to handle the young girls very carefully. Thank you very much.